25% of women skip their yearly mammogram because of fear and anxiety. Think about that for a second. That means 1/4 of women don't take this necessary, potentially life-saving step because of anxiety. Obviously, there's concern about the results, but there's also concern about the process. Inefficient workflows often lead to unclear results, extra tests, and repeat exams, which can frustrate caregivers and slow patient care. But there's a better way. Cinebright HD Contrast Enhanced Spectral Mammography is a new contrast technology that helps clinicians give women a decisive diagnosis in minutes. This mammogram technology expedites answers directly from the mammography suite, which not only helps to mitigate patient stress, it helps boost productivity and control costs with same day, same team, same machine follow-up. To us, that's an example of technology elevating radiology through greater workflow efficiency and greater patient care. Today, we're going to show you how technology can help you improve efficiency across your workflow as you face budget pressures, the need for more capacity, quality challenges, and staff burnout. Throughout the process of scanning, getting to the right diagnosis, treatment, and finally, managing your operations. Let's start with your next CT scan. As your patient lays down on the CT table, you start the positioning process. The aim is to adjust the position of the patient in micro movements until they're positioned optimally and ready for scanning. This can take a long time. In our Revolution Maxima CT, AI-based auto positioning completely automates this step. The camera uses real-time depth sensing technology to generate a 3D model of your patient's body, pinpoints the 3D center of the scan range, and aligns it with the ISO center of the bore, centering your patient completely hands-free. When contrast media is used to enhance images, your techs may spend significant time filling syringes, replacing disposables, and discarding unused contrast. The syringeless Ulrich Inject CT motion injector provides once daily setup and quick switching between contrast and saline, resulting in fewer workflow steps for improved operational efficiency with less contrast waste. And if you regularly perform ultrasound exams, you know that the repetitive motions, keystrokes, and movements over time can cause work-related musculoskeletal disorders. Auto Doppler Assistant on the Logic E10 ultrasound system uses AI-based tools to improve exam ergonomics, reducing keystrokes by up to 50% and time spent by 20%. So now let's talk about getting to a diagnosis, starting with a CT image. Using thousands of images, we trained our deep learning reconstruction engine for CT to generate true fidelity images that replace the plastic or flat look you get from iterative image reconstruction with deep detail, true texturing, and high fidelity. Today's radiologists regularly struggle to get the image quality they want due to a number of variables, everything from pathology to patient size to the technologist doing the scan. But what if there were an application that helped meet those challenges head on? Introducing Air Recon DL, which also delivers true fidelity images from a deep learning application designed to improve signal to noise, image sharpness, and enable shorter scan times. I've just referenced AI in CT, ultrasound, and MR. Now let me tell you how our AI implementation is unique. In a word, Edison. Edison is GE Healthcare's intelligence platform that enables applications to integrate and assimilate data from disparate sources and apply analytics or advanced algorithms built using AWS SageMaker. Edison AI applications can be embedded within existing workflows and securely deployed via cloud with edge hardware from HPE or directly on your smart devices. So what else can Edison do? As a radiologist, you know that there are times when critical findings in routine chest x-rays aren't spotted until long after the patient is imaged. Imagine if the x-ray machine could help you identify such critical findings. For example, you know what pneumothorax looks like in an x-ray, and now so does your mobile x-ray system. Thanks to Edison, our critical care suite can flag chest x-ray images with a suspected pneumothorax with a high diagnostic accuracy, helping you get to the right diagnosis faster. This powerful algorithm can now be integrated into your Centricity OpenPACS AI workflow as well. Any AI clinical application can be quickly and seamlessly integrated into the reading workflow to triage and prioritize exam work lists, as well as provide decision support in the radiologist's exam reviews. Workflow and clinical efficiency can't improve if technology isn't making it easier for people to act together. Take a multidisciplinary team that needs to review, align, and decide on the optimal treatment for the patient. The GE Roche Navify Tumor Board is a cloud-based workflow product that securely integrates and displays relevant aggregated data into a single, holistic patient dashboard for oncology care teams, including imaging data. It's this type of holistic perspective that generates the most relevant insights and does so in the least amount of time. Speed is important, especially in an emergency. A stroke patient is coming into the ED, and it's your watch. CT is the modality of choice, and seconds matter. You have to determine if it's hemorrhagic or ischemic, and you need to determine the appropriate treatment strategy, which means you need to see all of the acquired CT images as quickly as possible. Fast Stroke is an application that can be accessed directly from the operator console of your CT and from a remote client, so you can share the visualization with the stroke team. It processes the series and organizes the display for simple and fast evaluation of patients with suspicion of ischemic stroke. You can only act on what you see, so we're helping you see more. Like in the interventional suite, where imaging serves as an extension to your sense of sight. There are times when an interventionalist needs to see more with the least impact to the patient. Radiographers are often tinkering and adjusting doses manually to get the image that the interventionalist needs. So we've embedded AI technology, AutoWrite, into our image guidance systems portfolio to optimize image quality and dose in real time automatically. This is the first neural network-based interventional image chain to do so. And in times when interventionalists have very complex pathologies to treat, like prostate artery embolization, we can use advanced visualization to bring virtual injection capabilities to endovascular embolization with Embo Assist. So clinicians can confidently plan injection points based on 3D cone beam CT images, helping to reduce procedure time. But there are also times when a surgeon needs less to be more efficient, less disruption in the clinical workflow, and less obstruction of the monitor view. So we're introducing OEC Touch on OEC Elite CFD mobile C-arms. This intuitive control panel, located right on the C-arm, is designed to have more imaging capabilities easily available at the technologist's fingertips, reducing the number of times they step away from the workstation during surgery or block the surgeon's view. Workflow is impacted by more than just getting to the right diagnosis and treatment faster. You have to manage all of the other complexities that come with running an imaging department as well. Imaging Insights can help you manage your workflow from start to finish. The radiology module provides a fleet view through complete risk integration, focusing on patient experience, reading workflows, and scheduling based on historical information. In Chattanooga, Tennessee, we were able to help a customer increase capacity by 83 patients per month, maintaining the same staff and operating hours. Now, Imagine what that level of insight could mean if it was applied across your entire care continuum. For real-time management of your department, step into our Clinical Command Center, where apps or tiles from GE's Wall of Analytics can be used to drive accountability and action. Tiles provide operational decision support covering many topics, including next-level radiology efficiency. We have about 40 of these tiles. Let me take you through one called Imaging Expediter. This tile enables active management of imaging utilization by prioritizing scans and identifying a range of issues, such as missing or abnormal labs, which could disrupt flow in the near term. It's in use at Humber River Hospital for a single location and at Advent Health System, managing 96 CTs, MRs, X-rays, and ultrasound devices across 9 sites. All of the information is near time, updated every 30 seconds, created by fusing data from lab, pharmacy, radiology, patient record, and ADT systems, and applying advanced analytics, in some cases including machine learning. At Humber River, the tile has improved inpatient exam turnaround times for CT scans by 8%, MRIs by 10%, and ultrasounds by 14%. This is the power of data analytics and the kind of results you could have in your department or hospital. I've shown you just a few of our newest technology solutions, all designed to help you improve efficiency across your workflow as you face budget pressures, the need for more capacity, quality challenges, and staff burnout. We know delivering care in today's healthcare environment is not easy. Our commitment is to continue partnering with customers like you through innovations that help you improve your efficiency while providing great care. This is Elevating Radiology.